Case numbers will then start to come back down. Until the wave peaks, we do expect cases to grow. Yesterday we had 1,489 new cases. We now have 8 people in hospital, noting that only 3 are being treated for COVID. 5 are in hospital and have COVID, but are there for other reasons. Importantly, no one is in the ICU, and because of our high vaccination status, it means that the vast majority of cases that we're experiencing are all relatively mild. Now, this of course would be vastly different if we weren't vaccinated, which is why for the past 2 years the main tools at our disposal were lockdowns and lockouts. But we moved past that. In terms of Omicron, there is no way that border closures would keep this out of the state. We need to deal with it. Importantly, those most vulnerable, our elderly, are also our most vaccinated cohort. Now, however, this wave, while mild for most people, is presenting challenges. Not so much as a result of the severity of the disease. Our hospital system, which, as I've said, at the moment only has 3 people in it being treated for COVID. It's been ready to flex up to around 400 people being admitted. And in terms of ICU settings, we've got the capacity to take up to around 100 patients in ICU settings. So we are well prepared in a health sense. The challenges aren't because of positive cases, but rather because for every positive case we have 4 to 5 people on average isolating as close contacts. Now that means that at the moment we have around 20,000 people, we estimate, that are currently isolating across the state as close contacts. Now things will get better though, and in coming days, as the 7-day isolation period cycles out, we'll see corresponding numbers of people leaving isolation who are well, whether they were COVID positive cases or people that are deemed to be close contacts. Now in the meantime, it's important that we continue to take sensible steps to relieve pressure points on testing. From last night at 7 p.m, Tasmania moved to rapid antigen tests as a diagnostic tool to detect cases. For people with symptoms or those who are close contacts, these tests will be available for free, just as the PCR tests are free for people. To obtain a free rapid antigen test, you must register online or call the public health hotline if you are unable to register online. Our preferred method is to register online. Obviously, there's a lot of calls to the public health hotline. If you're simply registering, use the online form if you can, but if you can't, call the public health hotline number 1800 671 738. Now, I want to be clear, if you're neither symptomatic nor a close contact of somebody that is positive, you do not need to take a test. Our PCR tests, which are able to process up to 5,000 tests per day, and in fact they did so yesterday, will continue to be available to help provide testing capacity where it's needed and in priority settings, which Dr. Veach will outline in a moment. I'd point out that yesterday we distributed nearly 10,000 rapid antigen tests alone in the south of the state. If you test positive on a rapid antigen test, and I want to be really clear about this for people, whether that's one supplied through public health, through one of our centres, or if it's one that you take out of the bottom drawer of the bathroom cupboard at home or you've purchased in a shop, you must notify public health if you're positive. You must do that. Importantly, if you don't do that, we can't reach out and provide COVID at home. We can't assist you financially, and importantly, in terms of your working arrangements and leave arrangements, you will need to have registered. Now, it will be a requirement under direction and will ensure you can access, as I've said, assistance from public health, including COVID at home and those financial supports that are available. And you must then follow the guidelines and the advice from public health in terms of isolation. Isolate for 7 days, and if free from symptoms after that time, you no longer need to isolate. You must, however, for the next 7 days, if you've been a positive case, continue to wear a mask when out in the community and avoid high-risk settings. Your close contacts must also isolate for 7 days and undertake a RAT test on day 1 and day 6, and if negative on day 6, can leave isolation after the 7th day. Again, I want to be very clear on who is a close contact to avoid people isolating and testing when they don't need to. And there is a lot of testing occurring at the moment when people don't need to. A close contact is a person who you usually live with, such as your immediate family or housemates, or another household-like setting that you've spent 4 hours or more in, where there was a positive case during their infectious period when you were there. Importantly, it's not someone who works in the same business as you and wears a mask as you're going about your job. It's not somebody that you sat next to in a cafe that you went into wearing a mask, or that you passed by in a supermarket while you were shopping. Public health may also determine an event or a venue where those in attendance would be regarded as close contacts, and this will be publicly announced like we did with Party in the Apocalypse. We'll announce it publicly, and importantly we will use the Check-in Tas app to contact you to let you know whether or not you should go and get a test. All Tasmanians should use common sense and continue to monitor for symptoms. If you have symptoms, as I've said, organise to get a RAT test or a PCR test via public health. And as we transition more fully over time to full RAT testing, the PCR testing arrangements will remain in place. They are going to be there. As I've said, we flexed up to 5,000 tests a day. When you book a test, for some people you may not be able to get to a RAT distribution centre, and Kath will talk more about that in a moment. Turn up and get a PCR test. In coming weeks, as supplies come online in pharmacies, they'll also be distributing rapid antigen tests to specified concession card holders to those people that don't have symptoms but would like to have a test at home just in case. If they want to go and visit and have a family gathering, and they might want to take a RAT test for a purpose like that. So concession card holders, there's quite a long list, I won't read them out, but they are available and will be available in pharmacies. For those who are not symptomatic nor unwell, will be able to access tests there. And obviously anybody else's supplies come online will be able to go and purchase supplies themselves if they want to have some in the bottom drawer at home. Now, importantly, so that we can target our RATs to those people who need them, those that are either symptomatic or a close contact, from today we will not be providing them free at the airport as people enter Tasmania. So if you're a returning Tasmanian or a visitor, the rules are the same for everyone. Monitor yourself for symptoms. If you have symptoms, book, get online, organise to receive a RAT or a PCR test, or if you are notified that you are a close contact, get yourself a test, either PCR or a RAT. And Catherine Morgan-Wicks will speak more about the public health distribution system for RATs in a moment. But suffice to say, we will make them readily available for free to anyone that is eligible under the rules right across the state as supplies come online over coming weeks as we transition to the RAT test being the primary diagnostic test. In the meantime, our current PCR testing facilities are all available. Contact the public health hotline, or as I've said, go online to book a test if you want. Now, I know this is challenging, and there are some that are in our community who are feeling anxious. These are challenging times, but we are highly vaccinated, our health system is well prepared, and in coming weeks this wave will peak and it will pass. Right now though, if you're a young mobile adult, out and about and mixing a lot, be sensible in terms of the way that you manage yourself and follow social distancing rules and mask wearing, but more importantly, be sensible and responsible for your older family members as well. If you go out, more than likely you will bring this virus home with you to them. So just be sensible. In terms of priority settings, Dr. Veach will provide an update in terms of residential aged care facilities in a moment. But in terms of King Island, I spoke with the Mayor this morning, who is doing a fantastic job on the island, and today we will be establishing the Regional Emergency Management Committee to ensure that we can coordinate the response fully across the island. But I do want to urge people, if there is no need to go to King Island at the moment, don't. They are dealing with a significant outbreak. In the main, I understand that most people are well, and will continue to work with them as this process runs its course. But I do want to thank the Mayor for her engagement. I know that that island is in good hands under her stewardship, but importantly, we'll be putting in place and have been for the last couple of days the appropriate supports necessary. And I would make a point in terms of Dr. Veach, the approach of public health and the testing arrangements that have been put in place have been done so very, very quickly, and we'll work with that island as we work our way through. Now, before I hand over to Dr. Veach, we know that positive cases are going to rise. Yesterday in the south alone, on a day when we've had record PCR testing of 5,000 tests through the labs, we also handed out in the south alone nearly 10,000 rapid antigen tests. We want you to register if those tests come back positive, but we know as a result we are going to see a significant uplift in cases as we move forward, and people should ensure that they are ready for that. However, the most important thing is that we are highly vaccinated. We weren't over the last 2 years. We're one of the most highly vaccinated populations on the planet. And whilst this virus is spreading predominantly across our younger, more mobile population, I do once again want to say to them, I know what it was like to be in my 20s and 30s once as well. But importantly, what we're seeing is significant spread through this 20-year-olds to 39-year-olds. Just be sensible, make certain that you wear your mask, make certain that you have good hand hygiene, do the right thing. If you're going out and about, you will bring this virus home with you. That is a statement of fact. And importantly, I want you to do what you can to ensure that as we work our way through this, that we ensure that those that are more older or vulnerable in our community are as protected as we can make them. As I've said, we're going to see significant increases in case numbers in coming days as a result of the new testing protocols, and that shouldn't surprise anyone. But we've said cases of up to 2,000. I expect it's going to well and truly surpass that as we move forward. Importantly, our hospital system is well prepared. We are well prepared. We will get through this. I'm very confident in terms of the settings that we have and in terms of the plan that we're working to. I'll hand over to Dr. Veach now to make some comments.
Thank you, Premier, and good morning. So you will have heard that up until 8 o'clock last night, we diagnosed just short of 1,500 cases of COVID in Tasmania. Those cases occurred across the state. 2/3 of those cases ranged between 20 and 39 years. At the moment, 1 in 30 20-year-olds is an active case of COVID. I hope I just said that, just to make sure I've got the 20s and the 30s right. 1 in 30 20 to 29-year-olds, 1 in 30 people in their 20s, is a case of COVID. And as I've said before, that probably represents an underestimate of the number of people. Now, I'm not going to blame it all on the 20-year-olds. Cases are occurring across the entire age spectrum, but they're particularly high amongst younger Tasmanians. In contrast, fortunately, at this stage there are only 8 people in hospital, and only 3 of them with COVID-specific reasons for being in hospital. So that's around 1 in 500 cases being in hospital. That low hospitalisation rate is very encouraging, but of course it is partly as a result of the fact that cases at the moment are substantially young. The Premier mentioned a number of times, and I think it's absolutely worth reiterating. People have known for thousands of years that seasonal outbreaks of respiratory infections and pandemics that come along less often occur in waves. It was prominent in the influenza pandemic early this century when there were about 3 waves, but you can actually go back to reports from 3,000 years ago of outbreaks in ancient times where people recognised that these diseases occur in waves. The waves can be quite spiky, and I think in Tasmania at the moment we're seeing a particularly spiky wave of Omicron because it's spreading very quickly and has spread very quickly amongst very mobile, very socially active 20-year-olds. So I expect this current wave of Omicron that's being driven by the younger Tasmanian population to last a few more weeks, but we will get through it. I suspect that when we get through this, case numbers will drop away. We'll still see disease spreading, but probably less quickly amongst people in Tasmania who have less intense social networks than the 20-year-olds who are particularly affected at the moment. Just mention briefly the residential aged care facilities that are involved. As of 8 o'clock last night, there were 20 residential aged care facilities affected either by an outbreak of infection that had involved residents or were places where there was exposures due to infected workers. Around a third of those 20 facilities have got one or more affected residents. About 2/3 of those 20 facilities have got exposure situations where they're monitoring actively for cases because they've had an infected staff member. Just talk a little bit about our plans and our adaptations. We came into COVID nearly 2 years ago with a plan for pandemic influenza. We were all expecting that the next pandemic would be influenza, and that was a reasonable sort of suspicion. We'd had one in 2009 and there'd been others through the 20th century, and we hadn't had a major pandemic of another respiratory disease. So we quickly adapted the plan that we had set up for pandemic influenza to make it suitable for COVID. We didn't know much about COVID at the outset, so as we got more information, we adapted our plan to be more suitable to manage the threat that COVID was placing. Later on, when we came across Delta, a more transmissible strain of COVID, we made changes to our plan to adapt to that. And in the last few weeks, as we've faced the particular challenges of Omicron, we've adapted our plans again. A strength of our system is that we've got good emergency structures and processes in place, so we can adapt our plans. It can certainly be quite frantic at the outset and very busy. An enormous number of people have worked themselves extraordinarily hard over the last few weeks to adapt our processes to manage the threats of Omicron. And we're getting a plan in place. The things that people will notice is that there's a change in our diagnostic approach. We realise that with large numbers of mostly mild infections, it's impossible to run everybody who has potentially has COVID through a PCR-based testing process. That would be like trying to test everybody who has influenza each year. It's just not possible to do that with a laboratory-based system. So we've adapted very quickly to commission or arrange the purchase of rats and distribute the rapid antigen test that we already have to substantially supplement the testing that's going to be done through PCR. And I expect that that will be well in place over the next week or so. The approach is that we will be strongly encouraging people who have symptoms or require testing because they've just become a close contact to use a rat. And at the moment, the people who have symptoms, the people who are close contacts and need an initial and a day 6 test are being provided with rapid antigen tests. PCR tests are still available and they can be used by people in either of those categories by choice and availability, but we will over the coming weeks be increasingly doing more tests by rapid antigen test, and it will increase our capacity to do testing enormously. The public health response, as I've said several times, is moving away from a process of closely managed individual and contact management. When you have thousands of cases in a relatively small population such as Tasmania, it's simply not possible to reach out and to individually manage every case and every contact. However, we've produced and we're continuing to adapt and refine our resources so that people who are diagnosed as a case know what to do, people who are identified as a contact know what to do. And I'm quite confident really that most Tasmanians will find that relatively straightforward. The process is getting a bit simpler, and I'll conclude with a nutshell summary of it, but I'm confident that Tasmanians are actually able to manage being a case, being a contact, knowing that that's going to disrupt you like heck for a week, but after that week, most of those people will be getting back to their normal business. The focus of the public health response, as well as enabling people to substantially self-manage themselves as cases and contacts, is also to identify people who are at higher risk of complications of COVID. There's been a process in place for a while to do that, so that those people get COVID at home care or higher level care if they need it, and that will continue. People who are diagnosed by PCR have had their diagnosis notified automatically by the laboratories through to public health, and that initiates the reach out to those people for the offer of clinical care provision and assessment. With rapid antigen tests, people will be required to register on the public health website some basic demographic details, and that will initiate a very similar process to what's currently being used for PCR. That may be refined over the next couple of days, because all around the country people are developing processes to automate the role of rats within a clinical and public health response, and we'll be trying to have a system that's pretty consistent across all the country. But for the time being, if you have a positive rat, go to the website, register your details, and that will kick off the public health and clinical process that you need to be part of. The public health response will also continue to look at higher risk settings where there's a risk of more vulnerable people or more spread, and to support those settings to manage exposures and cases of coronavirus in their midst. So I'll just conclude by reiterating how cases and contacts are being managed. Cases are diagnosed either by a PCR test or a positive rat test, and they'll be required to isolate at home for 7 days after whichever positive test they've had. They're required to register their positive rat test, and as I mentioned, PCR is automatically notified. So if you're diagnosed by PCR, you don't have to register, because that happens automatically through the laboratories. But if you're diagnosed by rat, you go through the public health website. And please follow the advice there about pathways to clinical care and answer the questions that help us identify whether you could have been in a situation where there's a higher risk of COVID spread. And you'll also be advised to identify your close contacts according to the criteria that the Premier just mentioned, and direct them to information on our website that tells them what they have to do for 7 days. What they have to do as close contacts is quarantine at home for 7 days after their last exposure from a case, and do a rat test as soon as possible and at day 6.
So we heard from the Premier that there's 20,000 people isolating. With the figure expected to climb to 2,000 cases, how many people could we see isolating under that scenario?
Oh, lots of people. I mean, we see on average somewhere between just a couple of people as household close contacts. Some people have half a dozen or more. So, you can pick a multiplier of 4 or 5 out there and multiply the active cases by 4 or 5, and that'll give you a very rough figure of how many close contacts there are out there. That number is going to become very high, and those people are going to be quite disrupted for the next few weeks. But I expect that in the next month or so, we will start to go over the top of the peak of COVID, and those numbers will diminish. The other reason why close contacts are quite high at the moment is because of the quite active social lives of many people in their 20s and 30s.
In what situation are you identifying whether people have the Delta or Omicron variant?
It's a good question. One of the important reasons for keeping PCR testing going is because it gives us an isolate of the virus that we can actually send off for testing. And we have been sending strains of isolate off for testing. We focus on strains that are part of outbreaks, strains that may have come from people who've come from overseas, and those strains are becoming almost all Omicron.
And how many cases of Delta do we have, and are any of the hospitalisations Delta?
I can't tell you off the top of my head what the particular characterisation of the hospitalised cases, but that is another good point. People who are hospitalised with more severe illness, we do like to characterise their strains, but clearly they're in hospital, so there's an opportunity to do that even if they were initially diagnosed by rat.
We've actually been told that one of the people in hospital is on a ventilator and that the COVID ward is already full. So is that the case? Because
I would need to ask Kath Morgan-Wicks to respond to any questions about the hospital situations.
You mentioned the case numbers obviously being predominant people in their 20s. Have we seen many cases in children, and do you expect that number to spike once kids head back to school?
We have seen it is affecting people of all ages. I don't have a number immediately to hand on how many young children. Actually, I do. I'll see if I can tell you roughly how many there are. There are around 100 children aged under 10 who are current active cases. So they're people who've been diagnosed in the last week. So there's around about 10 to 20 children diagnosed today, and that's a really quite small proportion of all the cases. As children mix, there will be an increasing number of cases, and health is working with education to make sure that there's a safe process for children to return to school, and to balance the critically important educational objectives of having children at school with the risk of COVID.
Are any of those children in hospital?
I don't have the age distribution of the cases at hospital.
Are any of those cases linked to childcare centres?
I don't know the answer to that question.
And with the RAT test, there have been several concerns about the accuracy of the results. There are a number of people that have said that they have had negative a RAT result and then had a PCR test and they've actually been COVID positive. So considering that, why should we have confidence that the RAT tests will keep people safe?
The RAT tests actually perform very well, particularly in situations where where there's a lot of COVID circulating. They're not quite as accurate as PCR tests, but one of the difficulties is people will sometimes do a RAT test one day and then do a PCR test the next day because they have symptoms, and that's the right thing to do. You can even do a PCR test sometimes and it can come back negative if it's done early in the illness. But if you do a PCR test the next day, it's sometimes positive. And in fact, if you'd done the RAT the next day, it probably would have been positive too. But it's an entirely acceptable test with which won't miss many cases at all in a high prevalence environment. If people have got symptoms at the moment, they should actually assume that they have COVID, whether they've had a RAT test or a PCR test or not. But once you do get symptoms and you have a test, if you're positive, you go down the case pathway. If you still have symptoms, you should consider doing another test in the next day or so.
When you say symptoms, what are the most common symptoms for Omicron in particular?
The most common symptoms are those of a common cold.
And with the RAT tests, if they're not able to determine if it's Delta, does that mean that from here on in we won't have a proper understanding of how much Delta there is?
That's a good question. We absolutely recognise that if we move to a principally RAT-based diagnostic test, we don't get that information on whether strains are Omicron. So we do need to have a way of sampling people in the population, sampling tests to make sure we're keeping track. And we do that, as I think I mentioned, by selecting people who are in hospital is one particularly good way of doing it. Another way of doing it is if we identify that someone has been diagnosed after coming from overseas and could potentially have brought a different strain with them, we recommend they get tested. But there's a little bit of work happening nationally to work out what the surveillance plan should look like now that we're moving so quickly to using RATs.
This might be one more so for the Premier, but lines were sprawling out of pharmacies around Hobart this morning, just chatting to people, obviously trying to get those RAT tests. Are you confident about the supply being here to be able to, I guess, supply Tasmanians with what they need?
I'm happy to deal with that in a moment.
Yeah.
Yeah.
Have you got it, Captain Morgan?
Good morning, everyone. Today I'll provide an update on testing our THS services and vaccination. So to go to testing first, in the last 24 hours, demand for PCR testing has hit a new record. We've undertaken 5,208 tests in state and private clinics with a 6-day average of around 4,000 tests per day in Tasmania. And this is what the Department of Health has planned for, with 4,000 to 5,000 tests per day, supported by significantly upgraded Royal Hobart Hospital laboratory infrastructure. Previously, we have been reporting state clinic testing numbers, but we are now able to report both state and private clinic test numbers. And as we commence moving to rapid antigen testing as the primary diagnostic tool to detect cases of COVID-19, the Department of Health continues to work with the Department of Premier and Cabinet in securing increased supplies of rapid antigen tests and a statewide distribution model to ensure that people who are symptomatic or are close contacts can access these RATs as required. So from tomorrow, we'll be standing up rapid antigen test distribution sites at the Silver Dome in Launceston and the Sports Centre in Ulverston to complement our major sites in Rokeby and My State Arena. All of these sites will operate from 8 a.m. to 4 p.m. and these distribution collection points will only be for symptomatic people or close contacts of a positive case. They are not collection points for people who are asymptomatic or people that are not close contacts. Over the next fortnight, the Commonwealth will be working with pharmacies to distribute rapid antigen tests to concession card holders that are not symptomatic and not close contacts. If you are in a rural or regional area and you are symptomatic or a close contact of a case, please contact the Public Health Hotline to arrange to collect a rapid antigen test or to book to undertake a PCR test at a testing clinic. Importantly, we have capacity for 4,000 to 5,000 PCR tests a day in Tasmania, and these are not stopping. Bookings for PCR tests in state clinics are available online, and I encourage people to book online as much as possible. If you want to avoid a queue for a PCR, you can book for a PCR in a state clinic, with the wait time currently around 24 hours to receive your appointment time, with bookings as at this morning still available on the same day, so this afternoon. We have also moved to a new process of advising booked PCR appointments. When booking your PCR test, you will now receive a text message advising you of your appointment time and details. If you have tested positive for COVID-19 using a rapid antigen test, please complete your details in the rapid antigen test positive result declaration form, which is found on the coronavirus website. And as at 11 a.m. this morning, we've had close to 600 positive rapid antigen tests notified onto our website. This will allow Public Health to contact you with further information and advice about isolating and accessing medical assistance, including the COVID at Home program. And all information is kept strictly private and used by the Department of Health for case and contact management. If you test positive on a rapid antigen test, you must isolate immediately and advise people in your household to also quarantine. So if I can go to COVID at Home and community case management facilities, we currently have 350 cases enrolled in the COVID at Home program, with the majority experiencing mild symptoms. Yesterday, over 382 positive cases opted out of the COVID at Home program as they did not report feeling unwell, and they have our 1800 number should this change. We also had 116 discharged from the program in the last 24 hours. In addition, for those who can't isolate at home, we have 79 cases in our community case management facilities, with 6 being discharged in the last 24 hours. So in total, 330 people have been released from isolation from COVID in the last 24 hours. In our hospitals, the Royal Hobart Hospital remains at pandemic response level 3, with the LGH, Northwest Regional and Mersey Community Hospital at level 2. Statewide, we have 8 patients admitted to hospital who are COVID positive, of which 3 are receiving treatment for COVID, with 0 in ICU. Currently, we have 163 healthcare workers testing COVID positive, 100 in the south, 52 in the north and 11 in the northwest, and a number of staff that are also being regarded as close contacts. I am advised that there are no known staff transmissions within our hospital environments. All the staff appear to be affected, or infected I should say, from community exposures. The hospitals have established COVID testing capabilities on site for our staff who require routine testing, and staff who are symptomatic should not use these facilities but rather book in with priority at our PCR testing clinics. The external triage areas are operating at the Royal, at LGH and the Northwest Regional, and the Mersey Community Hospital triage area will open today. At the Royal, we are experiencing a high positive rapid antigen test in our emergency department screening areas for patients with risk factors, So we are moving to rapid antigen test all patients attending the emergency department. All patients being admitted will have a PCR test, including those who have no risk factors. If I can go to vaccination. Our vaccination rates continue to track very well, with close to 97% of Tasmanians aged 12 years and over having had 1 dose and more than 92% having had 2 doses. And now, of course, the focus is on boosters. With boosters, the number of people having had their booster shot continues to climb, and I'm pleased to say, as of yesterday, nearly 70,000 of the overall 270,000 eligible people have already had their booster shot. As you know, the current time for those aged 18 and over to be eligible for a booster is 4 months after your second dose. And we continue to add to the number of clinics available to increase the places at our existing state clinics, and thousands more appointments are available at state-run clinics for booster demand. Of course, participating community pharmacies and GPs are playing an extremely important role in our booster program, so you can book an appointment directly with them as well as our state-run clinics. That said, there are almost 15,000 people who still haven't had a first dose of COVID vaccine, and I'd like to really encourage those people now to come forward. And also those who are still to have a second dose, please come forward and finish the job. In terms of our 5 to 11s, a reminder that our children's program kicks off for our 5 to 11s on Monday, starting with Deloraine in the north, Latrobe in the northwest and Bridgewater in the south. And it will be rolling out across January with clinics next week across 12 locations and big clinics scheduled for the major centres at the end of next week and next weekend. And it's really pleasing to see the really strong take-up of our state-run children's clinics, with bookings now approaching 40% of those that are eligible in our 5 to 11 population, or over 17,000 children booked in across January.
Do you have an update on King Island's, this might have been a question for Dr. Beach, but do you have an update on how many people are now tested positive on King Island?
So as at the update yesterday, we had over 100 test positive.
On 60 confirmed positive and a number
and there was another
suspected
30
cases because of positive RAT tests.
Yeah, so we had anticipated, so at the update I received last night, that it was approaching the 100, but we'll put out a further release to confirm the total number.
And in terms of, I don't know if this is a dumb question or not, but 163 THS workers testing positive sounds like a lot for one department or one group of workers. Do they all have something in common about where they were moving about in the community that sort of accounts for such a high number of those workers now testing positive but not at work in the community?
So probably like everyone in terms of our healthcare workforce, we have a large portion that sits within that 20 to 39-year-old age bracket. And they've had a really hard year in 2021 and have enjoyed some, really earned a break over the Christmas and New Year's period. So I imagine they've done what other 20 to 39-year-olds have done, and that is to catch up with family, to have a break and to be mixing in social environments where this very transmissible virus has infected them. Now, 163 is a large number across our healthcare system, noting that we have over 16,000 employees in the Department of Health. But we are closely monitoring. Our THS Emergency Operations Centre receives updates every single day as to the number of staff that have been infected, and also so that we can provide support to them, including our COVID at Home service. And we are looking also at the close contacts that may be, often we have some healthcare workers that live together or share residences. So we are looking to provide the best support that we can, but to also bring in our close contact healthcare workers safely back into the environment where it is critical for our services to continue. We do that in a very safe way, which involves daily testing of those close contact healthcare workers, so they must test negative before entering into a healthcare environment, and through the appropriate use of PPE and not using any of our communal areas.
Just for the sake of people watching at home that couldn't see you shake your head, so there's no one on a ventilator in hospital, and the COVID ward is, we've been told, is at capacity at the Royal.
So we have no one that's currently on a ventilator in the reported numbers today. However, and often staff, for example, in hospitals may talk to people about seeing patient care. COVID patients can receive oxygen supplementation therapy, which is quite different to being ventilated in an ICU environment.
And the Premier was talking before about that we're ready to have up to 400 people admitted and up to 100 in ICU. What would that look like for the health system though? Would we, in that case, we'd have no elective surgery, or would it only be COVID patients in hospital?
So in terms of our the offer of elective surgery, and I should be really clear in terms of our surgical capability. So every single day we do surgery. We have a significant proportion of emergency surgery, and a lot of category 1 elective surgeries, for example, are not minor procedures. They are actually needed, and they're needed within a time frame. So we continue, and even through the shutdown of elective surgery last year, we continued with Cat 1 elective surgery, and we also supplemented private hospitals to take on that capacity. So we will do and continue surgery as long as we can safely provide it. It does depend on the staff numbers that are infected by COVID or may be close contacts, and that's why we are doing that daily monitoring. When we reach absolute extremes in a COVID environment, and I have to really emphasise we are so far from that extreme at the moment, with 8 patients in hospital, only 3 being treated for COVID. But once you do reach those extremes, which we have in our plans, yes, that does mean that other services across the hospital environment will reduce.
And just back to the high number of health workers that have a COVID positive, we've been given an internal document from the LGH that says staff members that are COVID positive can return to work after being asymptomatic for 72 hours. So does that mean we could have hospital staff that now can work while they're COVID positive if they're asymptomatic?
So I have seen various documents that our regional health commanders, for example, have been working through. They have been working through a furloughed policy which involves close contacts being returned to work, but it's a case-by-case basis, and they have to return negative tests and wear the appropriate PPE. In terms of the positive cases returning, the 72 hours in asymptomatic is usually after an isolation period. And the isolation period for COVID positive cases, healthcare worker or not, across the state is now being reduced to the 7 days. But we are absolutely taking every step carefully with our healthcare workers to make sure that we are minimising both the risk to them, so we don't want anyone that is symptomatic or unwell in our hospital environments, and the risk to our patients.
Still on the LGH, I understand planning started for them to move to the level 3 area of concern, I suppose. Does that concern you, or is that just common practice?
No, it actually shows that our escalation plans are working. We have escalation levels that are in our COVID preparedness for each of our hospitals. The Royal Hobart Hospital is currently at escalation level 3, and our LGH with I'm just going to check my numbers, 52 staff that are currently infected by COVID. We will consider that move to a level 3 escalation, but it will be due to staffing impacts rather than COVID cases in hospital.
And of those positive cases among the health workforce, how many are specialists? Can you break down a little bit about the positions of these people?
I don't currently have a breakdown in terms of the positions. However, that is examined every single day. So I think I mentioned a couple of days ago, for example, we had particular impacts in both neurology, nephrology, and we'll look at each of those and move specialists around the state to make sure that the critically unwell patients are continuing to receive that important service.
So if ICU rates did go to those extreme levels, which as you said, we're far from that, but if they did, would that also suggest higher levels amongst hospital staff, and would there then be potential issues with not enough staff for ICU?
So, and in terms of the ICU levels, or talking about how far we are from extreme, we're also watching what's occurring on a daily basis on the mainland, and we are just not seeing that impact in our ICUs across hospitals across Australia that we think that we're going to have a particular concern in Tasmania. We do have to maintain ICU capacity though in all of our hospitals, not just for COVID but for emergency surgeries, car accidents, things that happen in community, for example. We are watching every single day in terms of the staffing impact, and that's why we are taking those steps such as escalating up in our COVID management plan and looking at services that we can safely reduce. So, for example, our outpatient service, so that we can move those staff in to assist.
How many childcare workers have not been vaccinated yet?
I don't have a number on the current childcare vaccination rate, but I can get that for you.
Thank you. And what action would be taken if there were a number of people who in childcare who weren't vaccinated yet?
So it's in accordance with Dr. Veach's, and it's probably a question for Dr. Veach, but he has a public health direction that mandates the vaccination of childcare workers, and if similar to what we've experienced with aged care workers and healthcare workers with the mandatory vaccination, it involves then each employer dealing with those particular employees and not having them enter workplaces if not sufficiently vaccinated.
Do you know approximately how many RAT tests we currently have in Tasmania?
So this morning we started with around 125,000 in stock, and we are getting nearly every second day drops of rapid antigen tests. So I think we've got a further 90,000 arriving into the state on Sunday and 200,000 next week. So we are very confident with the supply of rapid antigen tests that we have for health purposes, remembering that that is for the priority symptomatic and close contacts.
Might make sense then to start with the RAT tests, with the 5 million tests arriving. When do you expect them to arrive, Premier?
Look, 2 million by the 14th of January and the remainder over the coming weeks after that. So, and as Catherine has indicated, these RAT tests will be utilised for those people that are symptomatic or who are designated close contacts. And we expect that we'll have sufficient supply. Now, and obviously, within our medical stockpile, we also have a significant supply of rapid antigen tests for our health workers as well, which has always been set aside as part of the store that we keep.
And in terms of the Delta and Omicron issue, there has been talk that there have been more hospitalisations in Melbourne because of more cases in Delta. Would the government consider changing its approach to this outbreak if we did see a rise in Delta cases?
Look, I think Dr. Veach has made clear from, in fact, the time that we had our very first cases that they were Omicron, and that we expect that Omicron will be the prevailing strain. But obviously we build a plan based around Delta as well, and we can manage both. But as he has said, in terms of the testing that occurs and with those people that are in hospital especially, obviously understanding the type of disease that will come through that testing.
Do you expect the pressure to be slightly off pharmacies once those state-run clinics are administering the free RAT tests?
Look, I want to say this to Tasmanians. Look, and I can understand how, at one point of this pandemic there was a desire to stock up on toilet paper. What we are seeing at the moment are a lot of people, the worried well, wanting to stock up on rapid antigen tests. So I'd make this point. If you need a rapid antigen test because you are symptomatic or you are a close contact, the state will provide them for free. But what we're seeing at the moment are a lot of people wanting to have rapid antigen tests in their bottom drawers, and that's going to obviously impact on supply. Now, my understanding is that the private supply lines, in terms of the pharmacies and supermarkets, will obviously continue to expand over coming weeks. But I think we've heard today of lines of people up outside of certain pharmacies. Again, if you need a rapid antigen test because you are symptomatic or you are a close contact, contact public health, get online, and we will make sure that you can have one.
In terms of the system that's been set up for people to register their result with the rapid antigen tests, there have been people expressing concerns about privacy and data security. How can you ease their concerns that their data will be kept private?
Well, Catherine Morgan-Wicks can provide more advice on it at the moment, but in terms of people registering, their data will only be used for the purposes for which it is collected, and that is to ensure that we can provide them with the supports that they may need should they be a positive case.
Dr. Veach said that there could be fivefold 20,000 people in isolation in coming weeks. What impact could that have on the workforce, and would you encourage employers to ask people to work from home under that situation?
Well, look, every employer can make a decision on that and how best to place their workforce. But what I would say, and this is the one thing that seems to be missed in this discussion, is that every 7 days those that have been in isolation, whether they are a positive case or whether they are a close contact, will return back to our community. And so it's not cumulative as we work our way through this. People will be going into isolation for either being a positive case or a close contact, and then after 7 days will be returning back to their lives. So whilst, as case counts rise, and we will see them rise as we reach the peak of this wave, we will see more people that are in isolation, but 7 days later we'll see those people coming back out. And this will be just an ongoing rolling process as we work through.
We're just a week out now from the Ashes. Are you confident that's still going ahead, and do you think it's still a good idea to have such a large event and, I suppose, a large amount of people coming into the state?
Well, in terms of the public health advice I've got, I certainly have no advice to the contrary. It is an outdoor event, it's fully vaxxed, people will be wearing masks, and I think that it is safe to go ahead. And until I receive contrary advice, I see the Ashes going ahead.
Earlier, you said that a close contact, you reiterated that a close contact is someone you've been with for four plus hours. Then you also said that if people are, young people are moving about, it's inevitable that they'll probably bring the virus home to their families. Which is it?
Well, in terms of people moving about, and I know that a number of people I've spoken to that have actually caught the virus, that went and spent 4 hours with a group of friends out on the tear on last Friday night. They were in their company for 4 hours and they've picked up the virus. Now, in terms of their home setting, obviously there's a very high risk that will transfer to the people in their home setting. I think it's really quite simple. Again, if you're going to go out and be out and about in our community, practice COVID-safe behaviour. We have all seen the photographs of events on Facebook in terms of young people jumping and dancing in mosh pits, not wearing masks. Just do the simple things, the little things, and it will help keep you safe.
So you said there'll be more isolation going forward. So can businesses then expect more hardship and more closures if they've got low staffing levels?
Again, I'd say to businesses that they need to manage their staff and their business continuity plans. We said just in the lead up to Christmas, and Dr. Veach made this point very well, that every business needed to reach into their bottom drawer and take their COVID-safe plan out. We'd had a very good run with COVID for nearly 2 years, but they need to get that COVID-safe plan out, and they needed to work to that. And importantly, in any setting, if staff are wearing face masks, if they are being mindful of their personal hygiene, sanitising, washing their hands, if customers and patrons to businesses are wearing their mask when they should. And I'd make this point, mask wearing is there, if you go to a restaurant, it doesn't mean that the moment you sit at the table, because you're going to eat and drink, that you take your mask off for 3 hours and sit there and leave your mask sitting on the table. Wear your mask if you're not eating and drinking. The rules are really quite simple, and if we continue to follow them, importantly, we will ensure that we move through this as well as we can.
Considering the rapid antigen tests are relatively new and people do seem concerned about whether they're using them properly or not, are you in talks with the federal government about the need for a bigger education campaign about addressing some of these concerns?
Well, importantly, in terms of rapid antigen tests in Tasmania, if you are uncomfortable using one, you can get a PCR test. And we are not going to pack up our state testing clinics. They will be available and they will do up to and more than 5,000 tests per day. So if people are uncomfortable for whatever reason or don't believe that they can use a test, then they can book in for a PCR test, and we will keep that process in place as we move through this.
A public awareness campaign did form part of Labor's plan for tackling Omicron. Did you look at that plan and what did you think of it?
Well, look, I thought it was a bit of a thought bubble, to be frank. Labor have had nothing constructive to say for nearly 2 years. Now, in terms of that plan, I did look at it, and in fact, in the main, most of those matters are either underway or have already been taken care of or begun. We said that when we went into this, that we would have a plan, and that plan has been to build hospital capacity. And as I said, just one point I would make. You know, the fact that we can have 400 hospital admissions and 100 people into ICU settings if we need to, that's about capacity building. It's not setting a target. What we're seeing is that Omicron is much milder. What we're seeing right across the country, as Catherine Morgan-Wicks has said, is that case numbers have been very high, and people obviously have a fascination with case numbers, but it's how that manifests itself into the care that people need. And right across the country, in percentage terms, as cases are rising, the number of people requiring hospitalisation and ICU are falling, and quite dramatically.
Are you worried that people might not register their RAT tests online?
Well, what I would say is this. For people that take a RAT test out of the bottom drawer that haven't received one from us, if it's positive, it's important that you register, because you may want to access financial support from state or federal governments, and we will provide pandemic isolation payments if you need to be isolated. Without having registered that RAT, you won't be eligible for that. Secondly, in terms of utilising any form of pandemic leave that you might have with your employer, if you haven't registered that RAT test, then you won't be able to access that leave either. But more importantly, we want you to register so that if we need to provide health support, we can, and that you're on the system and that you've been provided with the offer for COVID at home.
Do you think this honours system might impact statistics every day, and they might become less accurate in time?
Well, what I would hope is that people would do the right thing. It will be a direction from public health that you need to register, and for the life of me, I can see no reason why someone would not want to register when, in terms of it's important for their employment, it's important for receiving financial supports, but more importantly, it's important for their health should we need to provide them with services as a result of COVID at home.
Is it possible to fraudulently report a positive test in order to get that financial support?
Well, you need to make a declaration, and again, you know, the direction will be clear in terms of the requirements, and then you need to make a personal declaration in terms of that being your information.
Thanks all.
Thank you.